The American Cancer Society is known for some of its conflicts of interest, and recently they're finally backing down on some of their cancer screening tests. So what's going on?
Well, I think they're finally getting the message that the American public is waking up to what they're doing. I mean, they're basically owned by who? The people that fund them, the pharmaceutical industry and the technology industry. And so they support that, because if they don't have any money. And for years what they've done is they've advocated all these screening tests, not to prevent cancer, but to diagnose it early, which is a huge difference. And what a lot of people find is the flaw there.
Well, a lot of people think that that's prevention, and that's not prevention.
No, that's just finding it early. And sometimes finding it early isn't the best thing to do, even though you think, well, if you find it early, you could just remove it, right? Well, it doesn't turn out that way. And so until we have data that actually supports that what we're doing has more benefit than harm, we're making proclamations. We're assuming that things are getting better, and they might not be at all.
Well, one of the things that's happened is the U.S. Preventative Services Task Force has been putting a little bit of pressure on them. So let's remind everybody what happened with the Preventative Services Task Force a few years ago about mammograms.
It was just about a year ago. It was with mammograms, it was with colonoscopies, it was with PSAs. Their chief doctor came out and made a statement that he thought that maybe some of these tests are being overdone. And that was quoted in the New York Times.
And that caused a huge uproar.
Within 4 hours, okay, there was a change. He recanted what he said. The American Cancer Society came out firmly and said, these are tests that should be done. And of course, it's their conflicts of interest again. So
that would have been a big loss of money.
Oh, for Big Pharma, it would have been huge.
But you know, the other thing is that women have been so brainwashed about the importance of getting a mammogram that they just felt that it was being done for money reasons.
They thought we're trying to cut back on expenses.
Exactly.
And they were up in arms because they were just brainwashed, just like you said. So this whole thing about screening tests needs to be looked at carefully. Think of it this way. When we have screening tests that overdiagnose so that we wind up having to treat more people than we should, and it's on a rather large scale, who benefits from it? It's Big Pharma. It's the industry that does the testing. It's the doctors who do the reading for the radiologists. It's the surgeons.
Manufacturers of the equipment.
Sure. And it's the oncologists. They all benefit from it, and they're not apt to want to change that easily because that's cutting into their pocketbook.
But you know, one of the things that they just changed now is instead of having the specialists make the guidelines, because they're acknowledging that there's a conflict of interest with having them make the guidelines. Now they're going to have the generalists do it. In other words, the doctors that aren't specialists. But they will allow these people to be on the advisory board, which is a good thing. We've been talking about this for a long time. That we thought that this would be a good idea.
Well, you know, in theory,
so they must be listening to us.
Well, in theory, that's right. But what they're doing is they're blaming the oncologists for the problem. And they are the problem. The oncologists have never been in an authority position.
Who's they?
The oncologists have never been in a real authority position. They're sort of like the tail of the dog. But the pharmaceutical industry and the hospitals and the people that make all the technology that we use, they're the ones that are making the big dollars, and they're the ones that are controlling what happens. So what they're doing, what the American Cancer Society is doing, is they're making it look like they're the good guys, but they're not the good guys. I would never donate to the American Cancer Society for that reason.
And yet so many people that die of cancer, that's what they ask people to do in lieu of flowers, to donate to the American Cancer Society. And it sounds like a wonderful thing to do, but tell them what they do with the drug companies, with the places where they stay.
Oh, this is a story that was published a couple of years ago, and this was AstraZeneca that did it. And what they did is they funded money to build facilities where patients could stay if they lived too far away to get treatment. So they would have a place to stay that was free. You think, oh, that AstraZeneca is so good. And the American Cancer Society came right to the rescue, because what they were going to do is they were going to take over the job of building all these things so AstraZeneca wouldn't be put out. So everybody made a little money, at least the little guys made a little bit of money, but the AstraZeneca made the most, because what they were able to do is generate billions of dollars of interest, of profits over a period of 20 years for a minimal investment. And they built something like 23 facilities all through the American Cancer Society. So they were happy because they got money left over. Big Pharma was really happy because everybody got treated. But the real essence of what they're trying to say now, finally, okay, and I think this is great, is that we're over-treating too many patients, and that means that the result is that we're going to have a lot of patients that are going to be treated that didn't need it. That's good for big pharma, and it's good for the people who are in the business, but it's not good for the patients.
And some of the tests are invasive, like when you have a colonoscopy, for example.
Oh, yeah. You can die from that, and it's not as often, not as infrequent as you think. I mean, when you figure 1 in 200 people who have a colonoscopy as a routine screening, which is what we're talking about here, is going to have some kind of benefit from the procedure. But another 1 in 200 is going to have a perforation or a GI bleed that requires transfusions in the hospital. And the other good news from the point of view of not doing a colonoscopy is that if you have enough vitamin D in you and you exercise, your risk for getting something that's significant like a cancer is not 1 in 200, it's more like 1 in 400.
And we're not suggesting to throw the baby out with the bathwater and never do any of these tests, because there's a time and a place for these tests. I mean, some of them can be wonderful.
Exactly.
We're talking about doing them routinely,
and
some of them, the harms outweigh the benefits.
Absolutely. So let's keep in mind that it's good that we see the American Cancer Society making some small changes. I'll tell you, I don't trust them any further than I can throw them, that they're doing the minimal amount that they have to be adversarial to the pharmaceutical industry.